To other stories now, in the Ghana Health Service is racing against time to secure vaccines for poliomyelitis, which had been in a shortage across the country for close to 2 months. The infections caused by polio virus hit a 7-year high in 2020 when the country recorded nearly 700 new cases, up from the 376 in 2014. Now, in response, the Ghana Health Service increased its polio vaccination campaign to get more babies immunized, but the current shortage is threatening the fight against the virus, with thousands of children now exposed to the disease. We'll hear from the head of the expanded program on immunization at the Ghana Health Service shortly, but first, here's a report from the northern region. Martina Bugui reports on the situation in that part of the country.
There is a shortage of polio vaccines in the northern region. This has created panic among parents who have newborns who should have received the vaccine. The shortage in the northern region has discovered polio virus in some drains in Kobulmago in the Tamale metropolis and Nyanshegu in the Sanergo municipality. Some of the parents spoke to Joy News.
Well, it is quite unfortunate, but this is the sad reality that we are confronted with. It's been over a month and children are not being vaccinated for polio. We have gone around every facility in northern region, and I mean, you can't just have it. You see, the point of the matter remains that these vaccines are supposed to be given timelessly, and if the time elapses and even the vaccines come, the children cannot take it if the time is gone. So it's quite unfortunate. Perhaps I think that it's time we began to drum home to every stakeholder that is involved in this process, the whole process, that look, we need these vaccines and we need them badly.
But Deputy Director of Public Health at the Northern Regional Health Directorate, Dr. Hilarious Abewu, who confirmed the shortage, directed Joy News to the National Manager Expanded Program on Immunization.
Now, head of EPI at the Ghana Health Service, Dr. Kwame Amponsa-Chanu, says the service is working to secure the vaccines by next week. He spoke exclusively to my colleague Manuel Cranton of our health desk.
So the current shortage came around, I think, about a week or two ago, and we've been struggling, or we've been working hard to get polio into the country. Come Monday, we'll receive polio.
But you're saying Monday, and then we'll take you on that just briefly. But what was the reason for the shortage? Is it a global wave of shortage, or what exactly?
No, it's not a global wave. We had an issue with the manufacturer.
Okay.
We were in the process of changing the manufacturer, but then later on we advised that if we had to change, that we needed to get another kind of approval, and so it would be a complex thing. So we went back, and the manufacturer has now, in fact, there was shortage there, and so we wanted to move away.
Okay, so the manufacturer that produces for Ghana,
yes, for the one we tapped into, yes,
had a shortage,
yes.
And you wanted to move away,
yes,
and that was the reason for the shortage.
Yes, so we have had a long period of discussions and trying to get them to produce, and so now it's ready for pickup.
Okay, so when are we getting it?
On Monday we should get.
That's Monday.
No, you know, it's a long process. You see, first of all, it's not that simple. You need to do what we call a forecast for 2022. Normally you do that in the previous year. So we did that in 2021. Somewhere in November, that's when you plan for your consignments. And they normally have lead times, 6 weeks, 8 weeks, sometimes can go to 12 weeks before they can produce. You know, it's not a simple production like you go to the market and then get it. So it's a very complex process. But fortunately, the bottom line is that we are getting the vaccines by Monday.
I guess the question would be that, especially because we do forecasting, one would have thought that would have been able to preempt this gap before, moving to move away and all that.
That is very true. So we predicted this about almost 6 weeks ago, and we started working on that.
Okay.
And so it's taking us a long time to get here. It's not just an overnight thing. Because if you have shortage in, let's say, 2 weeks and you get a replacement, lead time sometimes 12 weeks. So what it means is that the production started earlier on. And so it's not a, I wouldn't say it's a very short.
Well, we've checked a few of the hospitals. I mean, maybe I'm not going to mention the names of the hospital, but a couple of the hospitals tell us that they had the shortage sometime around May into June, and that's
exactly what I'm saying. That about 2 weeks.
Okay. Well, let's now talk about the implication of the shortage for mothers and so on who are looking to vaccinate their babies and all of that. What's the implication for them?
Well, the implication going forward is not an issue. Previously, I mean, looking back, probably if there was a wild one lurking around, then probably you would probably get an outbreak or something. But normally it doesn't work like that, because we still have a vaccine that protects against polio.
Let's now bring in Dr. Thomas Anaba, who is the executive director of the Africa Center for Health Policy. Thank you very much, Dr. Anaba, for joining us here on Joy News Prime. So we heard that the Ghana Health Service already given us a timeline. We'll come into that as to whether that is actually possible, given the challenges we've seen. But as it stands now, parents, especially mothers, are being turned away from the health facilities. What is the real damage of this lack that we've seen?
Thank you very much for having me, and good evening to your viewers. I think this lack is going to cause what we call panic in mothers and parents, simply because we all know the consequences of polio. Having to give birth to a child, and just because of a common vaccine that's supposed to be around, the child doesn't get it, contracts polio, and become physically disabled and become a burden to the family. So definitely this is what is the consequences that the absence of the vaccine is causing. What I don't understand why is, if you are trying to change your sourcing point as a government, you should have preempted this and planned ahead of time before the current stock gets finished. I don't know why the government sits and waits for the stock to get finished before they plan to look for a new site to procure. If you haven't changed all the needed procurement processes to procure your vaccine from the new site, why do you stop buying it from the old site? This is bringing untold hardships and anger on parents who are not getting the vaccine to vaccinate their children. Let's all remember that polio is transmitted orophycal, meaning that contaminated water, food, and contact through people can cause it to be transmitted. We are in the rainy season. Places are getting flooded. Environmental polio can set in, even though it's not the wild type, but people can easily contract it because of water contamination, because we don't use sterile water to wash our bowls and everything. Luckily, children are lactating, but sometimes mothers, they play with others, and they can easily get contaminated and contract the virus and develop the polio. By the time you say the vaccine is in, the child has developed the illness already. What will you tell that parents? And that we shouldn't worry. We have to be worried. I think that planning was not well done. If planning was well done, there should have been a replacement of acquisition of with the current provider long before the consignment gets finished. And now for 2 good months, we are not getting back polio vaccine for our kids to protect them against a preventable illness.
But Dr. Chian, in that interview with my colleague, did indicate that they actually do a forecast to be able to manage the situation. Now he's giving us a timeline, which is by next week. Knowing how this runs, are we likely to get it? And would it be too late, or better late than never?
Then the forecast was poorly done. If it was properly done, we wouldn't have been having problems now. So we will take this with a pinch of salt, whether it will really come. And on Monday, let's be on him to ask him whether the vaccines have arrived. If they haven't arrived, then it means that they are causing serious harm to children in this country.
In the meantime, what can parents do, especially for those whose kids are up for vaccination?
What I'll tell parents is that at least let's try to make sure we stay away from contaminated waters We make sure we boil water if you don't have pure water in our houses. If you are bathing the children, boil the water, let it cool down before you use it to bath them. Don't use any water that has a risk of being contaminated to bath your kids. Perhaps if some goes into the mouth and contains any of the virus, then the child may be contracting the virus. That is the advice I'll give for now.
Thank you very much. That's Dr. Anaba. He's the Executive Director of the Africa Center for Health Policy, joining us on the shortage of polio vaccines.